Good morning, everybody, and welcome back to your Lunch Break Live. My name's Ivana. If you are new here, if you're not, thank you for coming back. Today is Tuesday, June the 8th, and today we're going to talk about a topic that I know a lot of people are very passionate about and very interested in, and that is organ transplants. There is new reporting this morning from our own Amy Yurkanin, who's joining me today, about liver transplants in Alabama and why some Alabamians are having to wait longer to get a liver transplant under some new rules than they used to have to wait. So Amy is here today to kind of explain her reporting, explain some of these rules, and why that Alabamians who are really in dire need of livers are having to wait a little bit longer. So Amy, thank you so much for coming on today, explaining this topic. I know you and I were talking before we went live about how organ donation is such a complicated topic. And if you have not maybe had a loved one go through it or yourself have not been through it, you might just think that it's as easy as getting your name put on a list and then they call you one day and say, oh, okay, your organ is here and it's ready. Come on in the hospital. But unfortunately, that is not usually how it works.
Yeah, thank you so much for having me, Ivana. I really appreciate it. And yeah, we're talking about this really important issue that kind of got, I think, pushed to the side over the last year during the pandemic, but this definitely affects the health of Alabamians. And basically, what I looked into was a rule that was enacted in 2019, which basically changed the way that livers are moved from donation into transplant. So it basically helps determine who gets a donated liver. And as you mentioned, this is a really complicated issue. And some of the issues basically boil down to the fact that we simply do not have enough organ donations to go around. So there are more people in the US and in Alabama who are waiting for a donated liver than there are donated livers to go around. So basically, the US has set a policy to determine who gets this really scarce resource. And in some cases, that really determines who lives and who dies. So the stakes are really high in this discussion. And prior to 2019, there was sort of a regional system for distributing organs. So if a liver was donated in Alabama, it either went to someone who was really critically ill, so someone who had basically about a week to live. But if the liver didn't match with someone in that category, the next person to get it would probably be someone in Alabama or Georgia or in sort of the region where the organ was donated. So that was how the system used to work. In 2019, the body that regulates organ donations kind of changed that system because there was arguments from different regions of the country that it wasn't fair for someone's geography to play such a large role in whether they got an organ donation. So their argument was that organs should go to the sickest patients regardless of where they lived. So it shouldn't be restricted to the area around where the organ was donated. And I think that argument actually, on the surface makes a lot of sense. I think that a lot of people can agree that the sickest patient who has a matching liver should probably get it first. I mean, it's hard to argue with that. But when you sort of drill down into this issue a little bit further, there are some major sort of problems with doing it this way. And I don't know.
I'm going to stop you real quick and just say, too, for anybody watching, unfortunately, there's different sets of rules for different organs, right? So this rule that we're talking about right now, this only affects liver transplants. Is that correct?
That's correct. I only looked at the liver transplant rules because those are the ones that changed in 2019. And in 2020, you had a lawsuit from a bunch of hospital transplant centers in the South and in the Midwest that tried to block this rule from taking effect. And basically they did block it for about a year. And then in 2020, a judge ruled that, the rule would go in place and that the changes would take place moving forward. So yes, this only is about liver transplants, not hearts, lungs, or kidneys or anything else, just livers.
I know that we have a, kidney transplants are something that is a very common thing. I feel like I hear every day of a new person that is needing a kidney transplant. We know that the University of Alabama at Birmingham, UAB Hospital, has a big transplant center as well. So I just wanted to make that clear that we're talking about this rule specifically for livers for the purposes of this video. Now, it might be worth looking at some of those rules and discussing it later, but the rule that we're talking about is solely livers. So sorry to interrupt you. Just wanted to make that point clear.
Yeah, no worries. And so here is kind of where it gets a little bit, it gets complicated, but I'm going to try to sort of lay it out very simply, which is the idea that a liver should go to the sickest patient. I think the bigger question becomes, how do you determine who's the sickest patient? The level of liver disease is measured by what's called a MELD score. And a MELD score is just based on somebody's blood work. It's as objective as it gets, right? Like you draw someone's blood, you measure the amounts of certain markers, and you determine who's the sickest. So that seems like a really straightforward way of measuring this. But there are some liver diseases that aren't reflected well that way. So a patient can get an exception to a MELD score that basically puts them higher on the liver list, the liver transplant list. And the issue that a lot of the Southern and Midwestern transplant centers have is that sort of these big, prominent hospitals in urban areas tend to have more patients with exceptions. So there is concern that some areas can basically manipulate this score to make their patients look sicker than they really are. And so the worry is that patients with access to really good healthcare and lots of hospitals, it may appear that they're sicker, but in fact, it's just that, you know, their hospitals may be a little savvier at working this system, or there just may be more patients with access to hospitals. Whereas in Alabama and in the South and in parts of the Midwest, you have more patients who just don't have access to that kind of, you know, really advanced healthcare to help them boost their score. So they're just as sick. They just don't look as sick necessarily.
Which makes them kind of fall back a little bit on this kind of national list, right?
Exactly. So that is one of the big concerns. And I spoke to a law professor who has done a lot of research on this. He specializes in health policy, and the research that he did, you know, seems to confirm that this is a process that can be manipulated to some extent. That what he found is that MELD scores appeared to be higher in places like the Northeast and the West Coast, or they were higher. MELD scores were higher in these areas, but you had more people dying on the wait list in places like Alabama and the Midwest. So that really seems to suggest that this scoring system that's supposed to be as objective as possible is not a perfect representation of how sick patients really are, and that there is the ability for some areas to pull organs away from really needy patients in the South and in the Midwest, and sort of move them to patients in the Northeast and the West Coast.
And something that I think is important here, and this is, Jane brought this up in the comments, and I think this is an important conversation to have. She says that if only more people would sign up to be organ donors, which, Jane, I think you're definitely right. There are more people who need organs than there are organs to be donated. That's an objective fact. But something interesting, Amy, that you report, and kind of to Jane's point, I'm looking at your story in front of me, and you reported that about 61% of Alabamians have signed up to be organ donors compared to just 20% of people in New York. So this is where things get a little bit more, can be viewed a little bit more as being quote unfair, right? Alabama does have a pretty high percentage of people who are willing to be organ donors. But if you have more people in the North, the Northeast, the Northwest, who are kind of at these hospitals or these healthcare centers that are able to make them higher on the list, that means that Alabama and Alabamians needing a transplant are not necessarily getting the advantage of having more organ donors in their state. You've got people coming in from out of state or vice versa that maybe need an organ just as badly, but their state is not doing as well in terms of organ donors. Is that a fair characterization?
Yeah, I mean, this is a big issue, that there's each state or each region has an organization that's supposed to sign people up as organ donors and supposed to collect organs from donors to be used in transplants. And the organization that does that in New York City is one of the ones that sort of notoriously has had problems in the past. So it's an organization called an organ procurement organization. And there's a sort of notoriously, I guess, underperforming, I should say. I haven't looked into it personally, but that's just generally there has been reporting done on it. And they struggle to both sign people up as organ donors and also to get organs into people who need them. And I think one of the issues that we're seeing with this new policy is that instead of kind of fixing the problems at the local level and trying to improve local donation rates, what this new policy does is it sort of just opens the door to getting organs from areas that do have a lot of success signing people up as organ donors and operating that system better. So it's definitely an issue here of, I think you and I mentioned it, where it's sort of like you're punishing the states that have high organ donation rates by taking the organs away from them. And I think that there is a concern that it doesn't fix the fundamental problems with some of these organ procurement organizations. It doesn't give them any incentive to sign more people up. It simply shifts the burden onto other areas like Alabama that already have, more organs. And another issue is that we do tend to have more organs available for donation in Alabama because we have more people who die young in ways that sort of produce more organs. And that's sort of the counter argument here is that we have high numbers of car accidents. We have younger people who have strokes. And so some of the other states will say that that some of those organs should maybe be provided to out-of-state organizations just because we have sort of this oversupply from people who die younger. And I mean, I think that argument is definitely compelling. But when you look at just the sort of the number of people who sign up for organ donation, Alabama is definitely doing better than New York. We do pretty well compared to a lot of states. There are states that are higher than us. I think Alaska is above 80%. And there are other states that are in the 70s and 80s. But Alabama, we have a high level of people who will donate organs, who sign up for that. And that helps. That the argument is that should be helping our patients closer to home.
And two, we've got a quote here that you have from the surgical director of the liver transplant program at UAB. And he says that essentially their patients are being hurt in the way that they used to maybe be, we'll call it eligible to get their liver transplant and get that transplant in at a level that was earlier in their disease and earlier in their sickness than what they are now. They're having to get sicker now before they get the transplant. Now, interesting comment here from Jason. He says he was on the UAB kidney transplant list for 5 years, never got a call, and then was contacted at Vanderbilt within a week of being listed. Jason, that is, again, we're talking, the rules are different here. And I think that is definitely worth the story. I know that there is a huge kidney transplant waiting list at UAB. And I think you have a good point, because that does kind of bring up something, Amy, that you and I were talking about, which is if you can get on at different hospitals, and if you have the ability to go to different facilities, if you have insurance, then it does put you at a better chance of getting that organ sooner than it does if you maybe do not have access to transportation, if you do not have insurance, if you do not have a very good local hospital, or if you don't have a local hospital that is very involved with a transplant program. It just kind of, I think what Joel said, it just really exacerbates a problem that is there. And it really does just show the flaws of a system that we have. Now we're looking to, I have somebody who's wanting to know about Alabama's young people and dying at higher rates. So you mentioned Amy, and that's a good point. I think that's a topic for another video, Jimmy, as you said, but that is an interesting point. Alabama is having, and southern states do have, a higher rate of people dying, in younger people dying at ways their organs can still be used. And again, I'm not a medical doctor, but there are plenty of ways that a person can pass away and their organs might not be able to be harvested to be used, which is always, sad on so many levels, because then they are not even getting to donate organs if that's what they chose to do. But Amy, you bring up a good point. Not only does Alabama have higher organ transplant rates, we also have, unfortunately, more people dying and being able to donate their organs, and then those organs go out of state. I can see a critic saying, look, if we're doing all the things that means we have more organs, why don't our patients get those organs?
Yeah. On the flip side, I think the argument from some of the other regions is that, and I hate to put it this way, but we have issues in Alabama with the health of our population. We have an unhealthier population on average than some of these other states. When you look at New York or you look at California, you have a healthier average population, which means that you have fewer young people dying in ways where they can donate organs. And so I think their point would be that they shouldn't be penalized for having a healthier population than we have. But I think the counter argument is that we already have so many issues with the health of our population. We already have, a lack of healthcare access in a lot of rural areas. We have lack of health insurance coverage for a lot of people. And by changing to this new organ donation system, we're basically just making our health care problems worse. Like, you're taking an area of the country that's already really struggling economically and with healthcare, and you are making access to donated organs harder. And I think that you have to look at the equity of that. Is that fair to the South when we already have so many struggles to add this one on top of it? And I think that that is the argument that a lot of the transplant centers made when they were trying to block these changes, was just that this is an area of the country that's already really struggling with health. We have high rates of stroke. We have high rates of heart disease and lung disease. Do we want to add another problem on top of that by making it more difficult for people to get, donated livers? And I think this is one area where we're doing well. We have high donation rates, and our population, or the population of the states around us, because it's not like livers were only offered in Alabama. They would also go to other southern states. We should be able to benefit from this. We need this because our healthcare system is already struggling. Our population health is already struggling. So this only makes it worse to make it more difficult for people to access these organs.
Fascinating story, fascinating reporting, Amy. Thank you for bringing it to us on AL.com and here. I do want to make a quick note that I have a couple people asking, why would Alabama make this change? But it is, this is fair to say, this is a nationwide change. This is a federal change. This is not something that was made at the state level.
Absolutely. So there is a federal body that governs organ transplants, and that is the group that changed the rules. They've been trying to change a bunch of rules to make the system work better, including increasing transparency. And I think that there is a lot of support for a lot of the changes they're making. This is just one that's really kind of it's always been a contentious issue. There have always been arguments about whether organs should be distributed on a more national level or a more regional level, and it kind of hits at the heart of these regional differences in donation rates, regional differences in population health, that can really kind of bring up a fairness issue. And there are medical ethicists who are looking at this and really trying their best to figure out the best way to distribute organs. It's a very difficult question to answer, and there are arguments on both sides. It's just that this particular change has not benefited Alabama patients. And as you mentioned, the transplant surgeon at UAB, Dr. Cannon, said that they have witnessed patients getting sicker in the last year, and they just have to wait and get sicker and sicker and sicker until they hit a level to which they will become eligible for an organ. And in the past, they didn't have to wait so long. They didn't have to get as sick to qualify. And now they're really seeing the effects of this policy 1 year in. And what the effects are is that people are indeed getting sicker in Alabama.
Not just not news anybody wants to hear, but important news to report. Amy, thank you so much for your reporting. Everybody, thank you for watching. There's a lot to follow up on here, and hopefully we will get to do that soon. So again, Amy and everybody, thank you so much for watching. We'll